Report tonight is Andy Slavitt. He's the former acting administrator of the Centers for Medicare and Medicaid Services under President Obama and was instrumental in the turnaround of the healthcare.gov rollout. He now happens to be board chair for the nonprofit group, the United States of Care. I hate, Andy, to start with a question like this, but can you tell us what our nation is likely to look like, say, 2 weeks from tonight?
Well, look, unfortunately, I think we're going to see that the numbers you just talked about, Brian, the 1,000, the number of deaths, they're going to continue to get higher and higher and higher, and these are going to feel like very much the good old days. This is a virus that none of us have an immunity for. We're not used to that. And we could be a triathlete. I think we're made of bronze. Doesn't matter. We have periods of time when we get this virus where we don't know we have it, and just by touching things or breathing air around others, the virus can pass from one to another. For some people, people who have an underlying illness or who are older, it's dangerous. It's potentially lethal, and so it's going to be very hard to get through and get rid of this virus. So I think we're going to be living through some adjustments. I think the positive way to look at this is we will all remember this period. It will wash through. The 1918 flu washed through eventually. We just need to get through it with as minimal lives lost as possible. And I think that's what we called out in this article, is that that's in everybody's hands, because the number of people we interact with and the number of people we pass the virus is going to have everything to do with how many people lose their lives.
I'm not a doctor, but it sure looked like near criminal malpractice the other night. I know you saw the pictures of arriving U.S. air passengers, O'Hare, Dallas, Fort Lauderdale, some of them in lines, cheek by jowl, next to each other for 6 hours. There was one report that people who'd been separated out because of high temperatures, part of the advanced screening, had lined up right next to the people who were well. How can we not have disease clusters now in some of these cities where these patients had 4 to 6 hours of unmitigated exposure to each other in a time when we're supposed to be social distancing?
Well, unfortunately, these are sometimes the lessons that we need in order to dramatically shake things up. You know, things like the NBA stopping its season sent a message to a number of people, hopefully young people, because it's really the young people that are the ones that are socializing more. People my age and older than my age are probably less at risk. But when we see scenes like that, that caused the governor of Illinois to take some action. That caused the federal government to take some action. And I actually think we saw a different President Trump today in his news conference, in the sense that I think he was seeing and expressing for the first time the gravity of the situation. Sadly, these are costly lessons, because if we were learning them 30 days earlier, and had tests out 30 days earlier, and we were isolating 30 days earlier, we would have a much more South Korea or Singapore like curve. As it is, we're on the very same curve that Italy is on. That's what has Governor Cuomo so shaken up. He wasn't afraid to say it this morning, because he's seen figures which show that he has about maybe 10% of the capacity of high intensity ICU beds that he might need in as little as several weeks from now. That has him ringing the alarm bell every day and as loud as he can.
Andy, if you were appointed special master tomorrow morning to run the government effort, let's call it the vice president's job now, what would be the first thing you'd want answered, or your first action that from a distance now you see that's not being done?
So I think there's two really critical things right now. Obviously, over the longer term, we need a virus vaccine. That's great. We've got scientists on that. But in the meantime, two things need to happen. One is we need to take our frontline healthcare workforce, which is a precious workforce, but they all have families. They can all catch this illness from their families, and they have very limited protective equipment. And they're going into battle for us on the front lines every day without a playbook. And we need to protect them. We need to have their backs. We need to have all of the equipment, protective gear, et cetera, we can possibly muster. We need every factory in this country and every company in this country and people who are out of work in the sector where they're creating gear to protect these folks, because we need them to show up, because when they get sick or when they stop showing up, we're going to be in trouble. And then the second thing I would do is I would make sure that we are doing everything we can as individuals to stay home. I think we're going to build a culture and an economy around this stay home environment, and we're going to learn to like it. And I think the other, I said two things, I lied. I'll give you, there's a third thing, which may even be the first thing. The most vulnerable populations are people who are living in nursing homes, elderly, people who are living in tight quarters, people with severe chronic conditions. We need to be thinking about that population and how to create the very best infection-free environment and pristine environment for those folks. And if you're a policymaker, that's what you got to do. And I would be hammering those things over and over again, because that's how we're going to lose the fewest lives.
Andy, thank you very much for that. You just reminded me to point out, while you're where you are tonight, if we look at all different or sound at all different, we're in a satellite studio where I can work alone and not risk or be exposed to any other folks, kind of the danger of our times. Andy Slavitt, we'd love to have you on again. Thank you for taking our questions tonight. Coming up, one of the risks of this global health crisis is the viral spread of disinformation, straight up lies.